Imagine this for a moment. You're lying in a hospital bed. The pain in your upper abdomen came out of nowhere. Sharp, deep, almost frightening. You keep wondering, what exactly is happening inside my body? And more importantly, how do doctors even figure this out? In part 1 of this series, we talked about the risk factors, causes, and prevention of pancreatitis, the silent habits and conditions that slowly push the pancreas toward inflammation. Today, in part 2, we're going deeper. We're going to talk about how pancreatitis is diagnosed, what tests actually mean, and how it's treated, step by step, in real life, not just in textbooks. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes and hormone specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, don't forget to subscribe to this channel for more simple, science-based, doctor-reviewed health videos that help you understand your body better every day. Now let's start where most patients do: confusion, fear, and questions. Take Mark, a 42-year-old software engineer from Texas. He came to the emergency room with severe upper belly pain that radiated to his back. He thought it was acidity, maybe food poisoning. But when the doctor gently pressed on his abdomen, Mark winced. That tenderness was the first clue. Diagnosing pancreatitis usually begins with a careful conversation. Your doctor listens to your symptoms, the pain, nausea, vomiting, fever, and reviews your medical history. Do you drink alcohol? Have you had gallstones before? High triglycerides? Certain medications? Then comes the physical exam. Doctors check your abdomen for pain, swelling, or guarding, the body's natural reaction to internal inflammation. But symptoms alone aren't enough. That's where tests come in. Blood tests are often the first step. They look for enzymes like amylase and lipase, substances released when the pancreas is inflamed. They also give clues about how your immune system, liver, kidneys, and other organs are coping with the stress. Next, imaging tests help doctors see what's happening. An abdominal ultrasound is commonly used first, especially if gallstones are suspected. It's painless and can show stones blocking the bile duct or signs of pancreatic swelling. A CT scan gives a much clearer picture. It can show how severe the inflammation is, whether there's tissue damage, fluid collection, or complications. Sometimes an MRI is used to look closely at the pancreas, gallbladder, and bile ducts, especially if doctors suspect structural problems or blockages. In more complex cases, doctors may recommend an endoscopic ultrasound. This involves passing a thin tube with a camera through the mouth into the digestive tract, allowing detailed images of the pancreas and nearby ducts. It can detect inflammation, stones, tumors, or blockages that other scans might miss. Another specialized procedure is ERCP, endoscopic retrograde cholangiopancreatography. It combines endoscopy with X-rays to examine and treat problems in the bile and pancreatic ducts. Doctors can even remove gallstones during this procedure. However, ERCP itself can sometimes trigger pancreatitis, so it's used carefully. For people with long-term symptoms, stool tests may be done. These check for excess fat, which suggests the pancreas isn't producing enough digestive enzymes. Pancreatic function tests, done during endoscopy, can directly measure how well the pancreas is working. Once pancreatitis is diagnosed, treatment begins. And here's something many people don't expect. There is no single pill that cures pancreatitis. Treatment usually starts in the hospital, focused on supporting the body while the pancreas heals. Pain control is essential. Pancreatitis pain can be intense, and doctors use medications carefully to keep patients comfortable. IV fluids are given through a vein because pancreatitis often causes severe dehydration. These fluids help protect the kidneys and maintain blood pressure. Nutrition is handled gently. Some patients can start eating once vomiting and pain improve. Others may need a feeding tube temporarily, allowing the gut to rest while still getting nutrition. Once the acute phase settles, doctors address the underlying cause. If gallstones cause the pancreatitis, an ERCP may be done to remove them. Later, surgery to remove the gallbladder, called a cholecystectomy, is often recommended to prevent future attacks. If alcohol or smoking played a role, stopping both becomes critical. Continuing either dramatically increases the risk of recurrence and complications. Doctors may recommend counseling, medications, or structured programs to help with quitting. If high triglycerides are the cause, medications and dietary changes are prescribed to bring levels down, because persistently, high triglycerides can trigger repeated attacks. If a medication caused pancreatitis, doctors work closely with the patient to find safer alternatives. Now let's talk about chronic pancreatitis, the long-term form. Meet Susan, a 55-year-old teacher. She had repeated attacks over the years. Now, her pain is constant, and she's losing weight despite eating normally. Chronic pancreatitis often needs additional care. Pain management becomes a priority, sometimes involving nerve-blocking injections or referral to pain specialists. When digestion is impaired, pancreatic enzyme supplements are prescribed. Taken with meals, they help the body absorb nutrients properly, reducing diarrhea and weight loss. Diet becomes part of treatment. A dietitian helps plan meals that are nutrient-rich, balanced, and easier to digest. In severe cases, surgery may be needed to improve drainage from the pancreas, or rarely, to remove part or all of it. After leaving the hospital, recovery continues at home. Stopping alcohol completely is essential, even if alcohol wasn't the original cause. Quitting smoking is equally important. A balanced diet with fruits, vegetables, whole grains, and lean protein supports healing, and staying well hydrated helps prevent complications. Here's the key message to remember. Pancreatitis is serious, but it is manageable. Early diagnosis, proper treatment, and lifestyle changes can dramatically improve outcomes and quality of life. Understanding what's happening inside your body takes away fear and replaces it with clarity and control. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, medicine specialist, diabetes and hormone specialist. Information collected from Mayo Clinic, Cleveland Clinic, and NHS UK. If you found this video helpful, please subscribe and share it, because awareness is the first step to healing.